Now that we've learned about psychological disorders, we can begin discussing how we can treat them. In this video, we'll cover a few basics about psychotherapy, and I'll tell you about different careers available to you if you're interested in helping people with psychological disorders, including what those careers look like and the credentials you'll need for them. According to a variety of sources, such as the U.S. Department of Health and Human Services, as well as the National Institute of Mental Health, roughly 19% of U.S. adults and teens, and about 13% of children between the ages of 8 and 15, suffered from mental illness in 2017. So as you can see, and as we've learned in previous videos, mental illness is common, which means it's incredibly important for us to be able to treat it effectively. And one way we can treat mental illness is through psychotherapy, a psychological intervention aimed at helping people resolve emotional, behavioral, and interpersonal problems so we can improve the quality of their lives. Before I tell you about these different careers, I have to go over just a little bit of terminology that I'll be using. First of all, we have a distinction in the setting that you'll be working in. Inpatient settings are ones such as hospitals or residential institutions. These tend to be cases that are more severe, very severe symptoms and cases. Outpatient settings, in contrast, are less severe symptoms and cases. Outpatient settings are ones where you're treating people who are living in a community rather than in a hospital, for example. We also have a distinction between involuntary treatment, where therapy is not the patient's choice. For example, if therapy is demanded by the criminal justice system as a condition for parole, that would be involuntary treatment, versus voluntary treatment, where therapy is sought out by the patient, by the person, voluntarily to relieve mental health symptoms. All right, let's go over a few careers. For each of these careers, I'm going to tell you the name of the career, I'm going to tell you a description of it, kind of the settings that they tend to work in, a little bit of the scope of practice, and I'll also tell you the degrees that you would need for that particular career. For these credentials that are listed at the bottom, as you'll see, you don't need all of them, so I should note that very importantly. All of these different degrees would qualify you to work in this kind of a capacity. So first here we have a clinical psychologist. Clinical psychologists, very broad, all sorts of settings they can work in. They can own their own private practice. They can work in a hospital or a school. They can work for community agencies. They can work in medical settings or in academia, in academic settings. They can be a professor, for example, of clinical psychology. Typically, in that case, they would be doing a mix of teaching and research as well into, for example, anxiety, depression, schizophrenia, whatever they're interested in, and perhaps research into the effectiveness of various treatments for those psychological problems. In terms of degrees, again, you can see several here. A PhD or a PsyD, these are both doctoral level degrees. They are different in a few key ways. A PhD is more of an academic degree where teaching and research are emphasized a little bit more. You can still go into clinical practice. You're still going to do an internship and get licensed here. But many people with the PhD go that academic professorial route, for example. A PsyD, in contrast, is a doctoral level degree where treatment is basically the sole focus. So you're not going to be doing research. You're still going to be reading research, right? So you can be up to date in best practices in the treatment of psychological disorders, but you're not going to be doing research. Couple of other differences here. There's a financial difference. A PhD is a free degree, and actually you get paid a little bit to do it. This is because you're often doing research. As I said, you're often serving as a teaching assistant for various classes when you're in grad school. So you're doing service to the university, for the university, and so they pay you. A PsyD, in contrast, you're not doing research. Usually you're not being a teaching assistant, although that can vary, and so typically you pay tuition. So it can be a very expensive degree, especially given that these are about 5 to 6 year long degrees. And so that's something to keep in mind as well. Master's degrees typically always require tuition. That can vary a little bit, but for the most part, they do require tuition. Thankfully, they are shorter degrees, though, typically about 2 years on average to complete a master's. In contrast to a clinical psychologist, we have a psychiatrist. And this is more of a medical degree. So here you're a physician, you're a doctor in the traditional sense. You can work in private practice, you can work in a hospital, medical centers, schools, or again in academic settings where you can teach as well and do research as well. So again, typically medical school, for example, is required to become a psychiatrist. You're going to be prescribing medicine. You're probably going to be making more money as well. So that's something to keep in mind too. Moving right along, we have a counseling psychologist. You can work in university clinics, mental health centers, and typically here, in contrast to the clinical psychologist and to the psychiatrist roles, you're going to be treating people with less severe psychological symptoms. All sorts of different degrees can, again, qualify you to work as a counseling psychologist. And a little bit of a different one, you can work as a school psychologist, where you work in schools. So you can develop interventions, for example, drug and substance abuse interventions. You can, create prevention programs like that. Typically, you're going to be working with some combination of students as well as their teachers and parents, and sort of the whole network that influences the student who is suffering from any sort of psychological problems here. And again, all sorts of different degrees, both doctoral and master's level degrees. Next, we have the clinical social worker. You can see several different social work specific degrees here. So a little bit different from the ones we've seen so far, like the PhD and the Masters of Arts. These have a unique degree to them. So you can work in private practice after you get enough experience. You can work in psychiatric facilities, in hospitals, schools, and so on. And typically you're helping people not just with psychological problems, but also social and health problems. So you're basically just really helping the person as a whole, holistic person. Next, we have the mental health counselor, again, working with slightly less severe issues as a clinical psychologist or psychiatrist would, but it's more of a range than, for example, the counseling psychology role that we just discussed. So you can own your own private practice, you can work in community agencies or hospitals, but you're doing everything from career counseling, right, on the more moderate end of the spectrum, to working with people with substance abuse issues, for example, so more serious concerns there. And last but not least, two final careers that I'm going to talk about. You can work as a psychiatric nurse, so in hospitals, in community health centers, primary care facilities, outpatient mental health clinics. You're going to be managing medications, and if you have one of these advanced degrees, you can see if you have an associate's degree or a bachelor, you're not going to be doing this. But if you have a doctoral level degree, like a PhD, you might be diagnosing or even treating patients as a psychiatric nurse. And last but not least, pastoral counseling. Here you're going to be providing people with counseling, but more in a spiritual context, right? So you're going to have wellness programs that you might develop. You're going to be working with an individual, maybe a group, maybe a couple, right? Like marital counseling, family as a whole family unit, that type of counseling. And the credentials here vary widely from bachelor's degrees all the way to advanced seminary degrees, for example. So there's all sorts of ways that you can participate in this field of psychotherapy. So I recommend figuring out what you're most interested in. How do you want to help people? Are you interested more in the medicine, more in the psychoanalysis, some combination of both? Are you interested in owning your own private practice one day, working in an academic setting, being a professor? What do you want to do? Figure that out first and work backwards from there. From there, you can figure out, what degree do I need? What credentials do I need to do this thing that I really want to do? That's the best way to move forward. That's the best way to figure out what you want to do for your career.